Welcome back to Alica Medical Insights. I'm Dr. Alica, and it is truly great to have you here today. I noticed our last video didn't resonate as much with you all. I'm listening to your feedback, and my goal is to provide insights that are genuinely useful for your health journey. Today, we're exposing a truth many healthcare providers overlook regarding medication. We are going to discuss a very common blood pressure pill that might be technically lowering your numbers, but is silently harming your long-term metabolic health and your overall vitality. If you felt fatigued, foggy, or just off since starting your treatment, this deep dive is specifically for you. We're moving beyond simple numbers to look at the whole body's response. Before we begin, a vital reminder. Never stop or change your medication without consulting your doctor first. Use this information to start an empowered conversation during your next medical appointment. Let's identify the culprit. We are talking about older diuretics, specifically hydrochlorothiazide, often abbreviated as HCTZ. It is frequently found in combination pills that doctors prescribe as a first-line defense. Providers persist in giving this pill because it is cheap, familiar, and effective at flushing out fluid. However, the price your body pays in the background is often far too high. Medical guidelines are shifting, yet the old-school approach remains the standard for millions. We need to ask why we are still using 1950s technology to treat a modern 2026 health crisis. In this 15-minute breakdown, we will cover the biological risks, the metabolic damage, and the safer alternatives that are available today. Knowledge is the first step toward reclaiming your cardiovascular health. Imagine your cardiovascular system is like a garden. HCTZ stops the flood, but it might be poisoning the soil in the process. We need to look at the garden as a whole. By the end of this video, you'll understand exactly how these pills interfere with your insulin, your electrolytes, and your brain. You'll be equipped to ask for a better treatment plan. Let's get into the hard science. We'll start with the most dangerous side effect of older diuretics, the diabetogenic effect. This is where the numbers on the scale begin to shift. Phase 2, the diabetogenic effect and blood sugar. This phase is crucial for understanding blood sugar changes. The term diabetogenic literally means a drug that causes diabetes. Studies have shown that older thiazide diuretics can significantly increase blood sugar levels and trigger insulin resistance in otherwise healthy people. When you take HCTZ, your body's ability to move sugar into your cells becomes impaired. This leads to higher circulating glucose, which eventually causes systemic inflammation and damage to your delicate blood vessels. It's a cruel irony. You are taking a pill to prevent heart disease, but the pill is increasing your risk of type 2 diabetes, one of the leading causes of heart attacks and strokes. And may Cynthia told when their blood sugar starts to rise. In reality, it may be a direct side effect of the medication their provider persists in giving. This insulin resistance also makes it incredibly difficult to lose weight. If you've been dieting and exercising but the scale won't budge, your blood pressure medication might be the hidden metabolic roadblock. Furthermore, insulin resistance drives more blood pressure spikes. It becomes a vicious cycle where the medication creates the very condition it is supposed to be managing in the long term for you. We also have to look at how these drugs affect your pancreas. They can reduce the secretion of insulin, making it even harder for your body to maintain a healthy and stable equilibrium. Medical literature has documented this for decades, yet HCTZ remains the most prescribed diuretic in the world. It's time we prioritize metabolic neutrality over simple convenience or low manufacturing costs. If you are already pre-diabetic, these drugs can push you over the edge into full-blown diabetes within months. This is a risk that every patient must be made aware of before starting. Ask your doctor if your medication is metabolically neutral. If the answer is no, you have every right to know. So let's discuss shifting to a class of drugs that protects your blood sugar levels. We aren't just managing a number on a monitor, we are managing your life, especially when developing diabetes while treating hypertension. There's a failure of modern clinical management that we must collectively address. Let's move on to the second major issue, electrolyte depletion. These water pills don't just flush out water, they flush out the very minerals your heart and muscles need to function. Potassium is the most critical mineral here. It is the electrical fuel for your heartbeat. When diuretics flush out potassium, your heart rhythm can become irregular, leading to palpitations and extreme fatigue. Many patients complain of muscle cramps or weakness and are told to just eat a banana. But a banana cannot address the underlying issue. Replace the massive amounts of potassium lost to daily diuretic use. Chronic low potassium also leads to higher blood pressure. The body compensates for the lack of minerals by tightening the blood vessels, which is exactly the opposite of what we want. Then there is magnesium. This mineral relaxes your arteries. Thiodiuretics are notorious for draining magnesium, which can lead to anxiety, insomnia, and even more severe cardiovascular tension and stress. Without enough magnesium, your blood vessels stay stiff. This makes your heart work harder, raising your pressure further. and creating a dangerous dependency on even higher doses of medication over time. We are essentially dehydrating our cells of the nutrients they need to heal themselves. Let's look at how this impacts your kidney function and your body's natural filtration system. Phase 3, kidney strain and uric acid. Your kidneys are the filters of your body. When you force them to flush out excess fluid using drugs like HCTZ, over time, this can lead to a decrease in your glomerular filtration rate, or GFR. This is a measure of how well your kidneys are working. If your GFR drops, you're in trouble. Another major red flag is the rise of uric acid. Diuretics prevent the kidneys from properly excreting uric acid, which can build up in your joints and cause the excruciating pain of gout. Many patients develop gout and are then given another pill to treat the gout, a perfect example of a prescribing cascade. We are treating side effects rather than addressing the root cause. High uric acid is also linked to kidney stones and chronic inflammation throughout the cardiovascular system. It's another hidden tax that your body pays for using these older, less refined medications. Now, let's talk about older beta blockers like atenolol. While these aren't diuretics, they're often given alongside them, and they carry a massive metabolic weight that slows you down. Beta blockers work by blocking adrenaline. This lowers your heart rate, and it also blunts your body's fight or flight response, which can lead to a profound sense of lethargy and depression. Patients on older beta blockers often report exercise intolerance. They want to get active to lower their blood pressure naturally, but their heart literally cannot speed up to meet the physical demand. This forced sedentary lifestyle leads to weight gain and muscle loss. We are taking away a patient's most powerful tool for health, movement, and replacing it with a chemical that makes them tired. These drugs can also mask the symptoms of low blood sugar. If you are diabetic and your sugar drops, you won't feel the warning signs, which can lead to a dangerous medical emergency. Older beta blockers are also notorious for causing weight creep. Even with no change in diet, patients often gain 5 to 10 pounds. Within the first year of starting these specific medications, your body is burning fewer calories at rest. This is due to a slowing of the basal metabolic rate because the heart and nervous system are less active. They're being artificially dampened by the pill. Furthermore, these drugs can raise your triglycerides, the fats in your blood. This contributes to the buildup of plaque in your arteries, increasing your long-term risk of heart disease and stroke. So we have a drug that lowers blood pressure but raises blood fats, slows metabolism, and causes weight gain. Does this sound like a comprehensive plan for cardiovascular wellness to you? We must demand better. Our newer versions of these drugs, like carvedilol or nebivolol, are much more metabolically friendly and don't carry the same heavy baggage as atenolol. Why does the medical system persist in giving the older versions? It often comes down to cost and institutional habit. These drugs have been around so long, they are incredibly cheap. But cheap medication becomes very expensive when it leads to secondary conditions like diabetes, kidney strain, and clinical depression. We need to look at the total cost to the patient. Let's pivot to the psychological and lifestyle impacts of these drugs. This is where most patients feel the most immediate decline in their day-to-day quality of life and happiness. Phase 4, brain fog, mood, and sexual health. Brain fog is one of the most common complaints I hear from patients on older blood pressure pills. They feel like they are moving through life in a daze, unable to focus. This is because these drugs can cross the blood-brain barrier and interfere with neurotransmitters. They reduce the delivery of oxygen and glucose to the cognitive centers of your brain's delicate structure. Vivid nightmares and insomnia are also frequent side effects. If you've stopped sleeping well since starting your medication, it's not just stress, it could be the chemical interaction in your brain. Then there is the mood tax. Patients on these drugs have a significantly higher risk of developing clinical depression. The blunting of the nervous system affects your ability to feel joy. If you felt a loss of interest in your hobbies or a persistent low mood, talk to your doctor about your medication. Your mental health is a vital sign that matters deeply. We also have to address the elephant in the room, sexual health. Older diuretics and beta blockers are the leading causes of drug-induced erectile dysfunction and low libido in both men and women. This side effect is so common that it's often accepted as normal, but it's not normal. It destroys relationships and quality of life, and there are many alternatives that don't cause this. Often, a patient will be prescribed another pill to fix the sexual dysfunction caused by the blood pressure pill. This is the prescribing cascade in action, and it must be stopped. When you go to your doctor, you need to be honest about these side effects. They are not trivial. They are indicators that the current medication is not a good fit. You deserve a treatment plan that allows you to feel like yourself. You shouldn't have to choose between a healthy heart and a fulfilling personal life. Both are possible together. Let's look at why doctors persist. It's often because they are following outdated clinical algorithms and haven't been updated to reflect the latest metabolic research on these specific drug classes. Many providers are also rushed. They see high numbers and reach for the most familiar, cheapest option to get the numbers down quickly without considering the long-term metabolic consequences. We are moving toward precision medicine, where we treat the person, not just the chart. This requires looking at your genetics, your lifestyle, and your specific metabolic risks before picking a pill. If your provider refuses to discuss alternatives, it might be time for a second opinion. A good doctor will prioritize your total health over a simple, quick fix that causes harm. Now, let's move into the solutions. What should you be taking instead? What are the safer options that protect your metabolism and your heart at the same time? These medications work differently. Instead of just flushing out fluid or slowing the heart, they target the hormones that cause blood vessels to tighten and become chronically inflamed. They are metabolically neutral, meaning they don't mess with your blood sugar or your weight. In fact, some ARBs might even help protect your kidneys and prevent future diabetes. Phase 5, Safer Alternatives and Action Plan. We will review these options together and create a plan that works for you. Medications like losartan or valsartan help relax the blood vessels and have been shown to actually improve insulin sensitivity in many patients. They don't cause the brain fog or the sexual dysfunction that the older drugs do. They allow you to remain active and sharp while keeping your cardiovascular system safe and protected. ACE inhibitors are another great option, although some people develop a dry cough. If you tolerate them, they offer excellent protection for the heart and kidneys without the metabolic side effects. If you must be on a diuretic, ask about chlorthalidone. It is more effective than HCTZ, lasts longer in the body, and has better outcomes for preventing heart attacks and strokes. If you must be on a beta blocker, ask about nebivolol. It is a newer third-generation beta blocker that actually helps dilate blood vessels and doesn't cause the same fatigue or weight gain. But the most important pilla is the one you don't swallow. We have to talk about the root causes of hypertension: inflammation, diet, and chronic physiological stress on the body. Magnesium supplementation under medical supervision can act as a natural calcium channel blocker. It relaxes the smooth muscles of your arteries, lowering pressure naturally and improving your overall sleep quality. Increasing your dietary potassium through greens, beans, and avocados can help your kidneys flush out sodium naturally without the need for a powerful pharmaceutical water pill every day. We also have to address vitamin D. Low vitamin D levels are strongly linked to high blood pressure, yet it is rarely checked in routine medical visits. Testing and supplementing can be life-changing. We also have to address vitamin D. Low vitamin D levels are strongly linked to high blood pressure, yet it is rarely checked in routine medical visits. Testing and supplementing can be life-changing. When you go to your next appointment, bring a list. What are the metabolic risks of this pill? And are there newer, safer alternatives that protect my blood sugar? Don't be afraid to be the difficult patient. Being curious and informed is how you survive a healthcare system that is often stretched too thin to provide personalized, high-quality care. Your doctor is your partner, but you are the CEO of your own body. You have the final say in what goes into it and how you want to feel every day. We are moving away from the era of a pill for every ill and moving into the era of true wellness. This starts with cleaning up your current prescription list and habits. Imagine how you would feel with more energy, a sharper mind, and a healthier heart. This isn't a dream, it's the result of making smarter, evidence-based medical decisions today. Imagine how you would feel with more energy, a sharper mind, and a healthier heart. This isn't a dream, it's the result of making smarter, evidence-based medical decisions today. Thank you for joining me for this deep dive into the hidden dangers of older blood pressure pills. I hope this empowers you to take the next step in your journey. At Alica Medical Insights, we are dedicated to bridging the gap between complex clinical data and your everyday health decisions. You deserve to live a life of total vitality. Let's wrap this up with a final summary and a clear call to action. I want you to take one specific step today to protect your cardiovascular and metabolic health. If you found this information valuable, please share it with a loved one. Awareness is the only way we can change the standard of care for our entire community and beyond. Subscribe to Alica Medical Insights for more evidence-based guidance. I'm Dr. Alica, helping you navigate the complex world of modern medicine with total confidence and a clear, healthy path. Final disclaimer: this video is for educational purposes only. It does not constitute medical advice. Always consult your personal licensed healthcare provider before making any changes to your medication or routine. Stay active, stay informed, and always prioritize your long-term health. I'll see you in the next medical insight. Remember, you have the power to heal and thrive every single day.